Hi, everybody, and welcome to today's webinar, Food Matters, Cook Like Your Life Depends on It. I'm Heidi Mastrud, Director of Alumni Relations at the School of Public Health. Thanks to all alumni, students, and friends of the school who've made time to join us live today. Our webinar today is a special preview of a course available to you through the Public Health Institute this spring. Webinars like this one are a chance to hear about new classes offered at the PHI directly from the faculty who are teaching them. Get a first look at these new classes and then sign up to participate. Whether you're joining us because you're curious to learn a little bit about this or checking out if the class is right for you, welcome. We'll touch on how to register for the course at the end of the webinar. Questions are welcome at any time. You can submit them through the Q&A panel on the right side of your screen. We'll be monitoring questions along the way, so please submit your questions or comments whenever it's convenient to you. And now on to the webinar. First, I'd like to introduce the presenter of our webinar, Jenny Breen. Jenny's been a professional chef and advocate for local and sustainably raised food since the mid-1980s. She was co-owner of Good Life Cafe and Catering, a sustainable whole foods business from '96 through 2013. As a 2009 Bush Foundation Leadership Fellow, she completed her MPH in Nutrition at the U of M to build networks within health and food systems for greater access to food, support for sustainable farming, and to promote cooking as a health strategy. Her cookbook, Cooking Up the Good Life, was released in April of 2011 from the University of Minnesota Press. She's faculty in culinary nutrition at the Bakken Center for Spirituality and Healing and teaches 3 courses at the U: Food Choices, Healing the Earth, Healing Ourselves, which is an online class; Food Matters, Cook as If Your Life Depends on It for graduate level health professional students; and a food systems approach to cooking through the Healthy Foods, Healthy Lives Institute. She contracts as a culinary and nutrition public health educator with local health departments, school districts, nonprofit food and farming organizations, and partners with the Good Acre Food Hub on culinary and food systems trainings, and for school food service and FACS educators, healthcare practitioners, and the general public. Jenny, we are so happy to have you here with us today. And now I'm going to turn the webinar over to you, and you can advance the slides in just a second.
Hello, can you all hear me?
Yep, sounds good. Everybody's on mute right now, but I think you're sounding good, so feel free to get started when you want.
Okay, hi everyone. Thanks for joining. Thanks for the introduction. This is my first time teaching a Public Health Institute. I'm really excited about it. It's a great format. I love the opportunity. As was mentioned, I got my master's in Public Health Nutrition at the U. I was an older student, which I believe was an advantage, and it gave me lots of opportunities to dig into the topic that I'm going to talk about today, and ultimately now here I am teaching about it. So the presentation that you're looking at is actually a presentation that I just gave last week, so it's actually a little bit of a window into some of the consulting work that I do outside of the university. I'm in the process of, with my doctor colleague, who will also be co-teaching this Public Health Institute with me, we are starting to do more consulting and training out in the community with community health workers, because as public health students or professionals, you probably know that community-based education and training is really the on-the-ground work that often makes systems change, and so that's where I really tend to find myself working. So I won't go through this so much, but this is a really kind of basic introduction to the content that will be presented in the Institute. So Dr. Shafto and I teach a course for health professional students already, and that includes medical students, nursing students, public health students, pharmacy students, social work students, because we believe that food, and specifically cooking food, are preventative health strategies, and that folks in all of those different health fields get very little, if any, training in making that connection. And so we really start with the basics. I won't do this exercise, but we do an activity called Your Food Story. I do this with any audience, whether I'm working with people who are on food stamps or doctors or nurses or, health professional students, because I think it's really important for people to understand that everyone has a food story. We all are somewhere within that story. We all have a relationship with food that goes back to the day we were born and continues well beyond. And unless we understand a little more about each other's context, regardless of where we work. So if I'm a doctor, if I'm working as a public health professional in a clinic, if I'm working with a farmer, if I'm teaching somebody how to cook who is homeless or on food stamps, I need to understand their context and their story. And it's really a problem, I think, of the healthcare and the public health system right now, that we make a lot of assumptions and deliver our services or our work without having that context and that story. So that's where we will always start. And it's also a really fun way to get to know people and build trust in any setting. So the context from which I come from is this idea that cooking has become optional. We live in a system now where we don't actually have to procure or provide our own food for us if we don't want to. And so we have found ourselves in a situation where we are consuming highly processed, industrialized food from all sorts of ingredients, and that is leading to multiple health problems, both human health problems, but also environmental health problems. This is specifically something I put in this presentation for community health workers, because they are, as I said, they're really on the ground kind of liaising between mostly folks with limited access to healthcare and often food and the healthcare system. And they don't really have the resources to answer any kinds of nutrition questions. And it's also an example of the approach that I take to talking about nutrition. So I'm a little unconventional. Because I'm not a registered dietitian, I haven't vowed to represent the USDA. I do sometimes talk about it as from a bit of a critical lens, just in terms of the nutrition information that we get from our government and how to translate that and understand it in the context of a food system and our agricultural system and our health system, and understanding things like milk is not necessarily the best source of calcium is really important, especially if you're working in a community, for example, that is lactose intolerant. But in general, I think we need to be able to understand these things. So these are some of the nutrition myths we talk about. Fat's really confusing, unbelievably confusing for people who are not nutrition experts and trying to figure out what they should eat. So we really break that one down. Calorie, that's another term that a lot of people may have heard in the nutrition world. Calories in, calories out. A calorie is a calorie is a calorie. That's just not true, and I think it's really confusing. And one thing I like to say to people is that the way that we've been teaching people to be attentive to their nutrition, and whether they're trying to lose weight or prevent diabetes or whatever their issue is, has not been working. And so this idea that we can just tell people to count calories or measure grams of protein or fat has not been a very effective strategy. And so I really, really spend a lot of time talking with people about counseling people about quality of their food and learning how to identify real whole food and then what to do with it. So we do an okay job of telling people what they should eat, but we really don't help them figure out how to actually do that. So I'm a real big believer in the experiential learning as a critical piece to that. This is specifically maybe more talking about the medical system, but I think in the public health world, this is equally actually in any place where we're working in community settings, this is really important. But our medical system in particular is this crazy setup of reactive acute care where we aren't even teaching the people who are doing the care how to take care of themselves. And so we have a situation where people are burned out before they're even trying to help other people be well. And I firmly believe, regardless of the work that you do, that you cannot do a good job of taking care of other people if you're not taking care of yourself. And so health education, whether it's public health or mental health or medical health, which obviously are all connected, needs to start with health of the individual. So we talk a lot about that. I'm not sure who's listening, but those of you who are listening may be familiar with some of this information. This is just a simple pie chart of the standard American diet. This is probably several years old right now. It may look a little different. I would imagine that little green slice and blue slice aren't bigger. I would imagine, if anything, the yellow section is bigger, but it just shows us of all the food that we consume, that little 10% is unrefined plant food. So that includes everything: fruits, vegetables, beans, nuts, and seeds. And that is that ratio is a major source of all of the chronic disease that we have now. So we have to really look at what we're doing and what needs to change upstream. I talk a lot about human consumption in relation to environmental health. I think it's really important that we understand that these two things, human health and environmental health, are completely linked, and that we really aren't impacting one without also impacting the other. So this is another way of looking at that standard American diet diagram and just understanding the correlation between the choices that we're making and what we're consuming and how that relates to specifically greenhouse gas emissions in this case. This is from Bob Lawrence, who just retired from the Center for a Livable Future at Johns Hopkins, but that did quite a lot of research on the relationship of human consumption to environmental health. And I think this is just a really telling image. There are many others. This is another really great image that I think also helps to kind of break this down. I use this in all the classes that I teach. So it's a pyramid, which we don't necessarily use anymore, but what is helpful is that it sets the sort of environmental impact right next to the food consumption. And so we can see, I think, really easily that there's this really, really strong correlation between the foods that are really good for humans and the foods that have the lowest environmental impact being the same. So the ones at the top, the pointy part of the environmental pyramid, are meaning the ones that have the least environmental impact, and the ones at the bottom of the food pyramid, of course, are the foods that we should be eating most of. And if you'll notice, fruits and vegetables are underneath grains, which I think is different than what our food guide pyramid used to say. But anyway, this comes from Barilla, which is an Italian pasta company, but they do an extraordinary amount of research and education around environmental sustainability. They're very committed to sustainability. Yet another double pyramid. This really is getting more into the human health side of things. So our gut microbiome and how our gut health is very tied also to our diet. And again, all of these things could be put together. So what's good for us is good for our gut, is also good for the environment. Nature's pretty smart. I like to remember to tell people or remind people of that most of the time nature has done what is best for us just naturally. And so the less we try and mess with that and improve on that, often the better things are. We do an activity, and I'm going to go back and forth a few times with these three slides because it's a comparison. This is obviously our USDA My Plate. This comes from the Harvard School of Public Health, the Harvard Health Eating Plate. I'm assuming some of you might be familiar with this. This comes from the Center for Mind-Body Medicine. It's from a food as medicine training that I participated in. It's not necessarily publicly available, but I like to show these three to students just to start some discussion about what influences nutrition and dietary guidelines, where they come from, and why these don't all look the same. So we end up getting pretty quickly into a discussion about government and corporate interests and how those two things sometimes come together and end up as policies, even if they may or may not be the most, the best for human health, and how that can then be very confusing if you are a consumer who doesn't have a lot of information or education around these things. How do you discern and how do you weed through what is correct and what you should be doing and what's best for you versus maybe what's better for other interests? So again, this was a presentation to community health workers. So what do we teach our patients? I really like to just talk about whole foods, ingredients-based eating. So this is a really, really different, my colleague, Dr. Shafto, obviously sees patients, and in some ways this is like the first time that people let go of stress and start feeling like they can just eat because they're not so busy measuring and counting and weighing and calculating. And instead, and this is really, really true, if we focus on real whole foods and things like, we call it naturally occurring fats. Healthy fats is a very vague term, but naturally occurring, in other words, fats that you find in nature. If we focus on these things that just sort of exist as they are, we can eat quite a lot of that stuff without having to worry about over-consuming. And part of that is because when we eat these real whole foods, we are naturally satisfied. We aren't eating highly processed, refined grains that are going right into our blood and not taking any time for this, so they're not sustaining us or satiating us in any way. So we all of a sudden find that we are eating and enjoying eating and not eating too much because we're satisfied. So there's sort of this natural thing that happens when we start focusing on ingredients instead of calories or grams or fats or such things. And then also really helping people understand what are processed foods. What does a processed oil, what does that mean? What's a refined grain? What does that mean? What does it look like? What's the difference? These are things that often we hear and we assume people understand, but they may not. And so getting in the kitchen, again, is a really excellent way to experientially help people understand it. Shopping, cooking, eating on a budget, obviously everybody's dealing with this challenge, and I think more often than not, you find people who feel that they can't eat healthy because they can't afford it. So that's another thing that we really like to break down and, look at from all the different pieces. So what I often will tell people is that cooking and eating healthy isn't necessarily more expensive in money, but it can be more expensive in time. You do have to commit and prioritize and take the time to plan and prepare food. However, if you don't do that, you're going to spend money and time dealing with health problems. So nobody gets out of spending the money and time that it takes to be healthy. Either you spend it on the front end or you spend it later. So here's just some resources for talking about that. This is another really great thing. These 5 things alone are huge. Eating vegetarian, so I don't advocate or I'm not a proponent for any specific diet, but I do encourage people to change the portions on their plate and to recognize that we don't need to eat as much meat as typically Americans do. And if we scale back on the meat, we can spend more on other things like whole vegetables and whole grains. Buying in bulk is a really great way to manage. We can buy as much or as little as we want, and we don't buy expensive packaging, and we also just have more choices. Eating more fiber, well, that comes with eating whole foods, but the more fiber we eat, the more satisfied we are, which means we're not looking for snacks all the time. Packing your own lunch, We all know that that's just one of those things that prevents us from going out and buying stuff that we probably wouldn't eat otherwise. Carrying a water bottle. It just means that you have your beverage. There's only one beverage that anybody needs ever, and that's water. Coffee and tea are reasonable water options, but soda and juice, et cetera, are simply not necessities ever. And if we have a beverage, then it's easier to avoid buying those other beverages. References are here. I usually end, and we will do this in the Institute. We will cook and we will eat each day in our class. We're going to be in a few different sites, which is kind of fun. We're going to be in the food science labs one day, the Good Acre Food Hub a couple days, and we haven't figured out our last day yet. And there is a student assignment, a cooking assignment for that last day. So, but we do always talk about and practice mindful eating. That's another thing that I love to tell people. Anybody can do it. Doesn't cost anything, and it's an extraordinary skill to add into your own routine for your own health and well-being and actual absorption of nutrients. If we actually don't pay attention, if we're super busy or stressed or not paying attention to our food, even if we are eating healthy food, we may or may not absorb all the nutrients that we are meant to. So mindfulness is a nutrition strategy as much as just a wellness approach. And that is it. I blew through those really quickly, but I didn't want to teach the class. I'm hoping people will take the class, and I'm happy to answer any questions.
Thanks so much, Jenny. If folks do have questions, I would encourage you to put them into the Q&A box on the right-hand side of your screen, and we'll get through as many as possible. And while we wait for anyone who has a question, I wonder, do you have any tips, Jenny, for as a non-public health nutritionist, I notice there's a lot of hysteria, especially online, when people talk about food and food choices. And how do you have any ideas about how to cut through that and kind of get to the heart of being an advocate for people feeding themselves well?
Yeah, that's a really great question, and that hysteria, I think it comes from both. Now we have social media, and so there's just so much information that we're bombarded with, and this person's talking about keto, and this person's doing this, and they're all talking about the amazing results, whatever it is that they have. And it's, if it was hard before, it's 20 times harder now to weed through what's right. And I think, honestly, this is why I go back to that, really keeping it simple, like just eat real food. I actually like to tell people it's not rocket science. It's really not super complicated. We have made it really complicated, and we've gotten all freaked out, and there's so much information that it's overwhelming. And so I really just like to encourage people to get kind of back up and weed through what we do. Pantry activity where we have people go home and just sort of look through their pantry and look at what's in it and what all the hidden things in all of the packaged food that they might have. And I think if we just have a few tools in our toolkit to sort of shop for and prepare delicious, simple, healthy food, then we stop freaking out and feeling like there's some big secret that we don't know. And we start also realizing how good it feels to just have a good meal. And then with the mindfulness and the slowing down, and then maybe we'll have another one. And then pretty soon people are going, wow, this is really, I feel good. I'm not freaking out. This isn't as complicated as I thought it was. So I think the fads I think you're right. There's a lot of hysteria. It's very overwhelming. And so my hope, and I think that this has proven to be true, is that by the end of a course, people leave with a significant toolbox and confidence that they can execute a number of reasonably delicious, healthy, affordable meals for themselves and whoever they cook for.
great. Thank you. I'll give folks maybe another 30 seconds to raise questions if you have any, either about the content of the course, how to register, or anything else that you'd like Jenny to weigh in on. And in the interim, I've put the URL for where you can register for this course and find out about all of the Public Health Institute courses online. This particular class is May 20th through 24th, and if you have other questions about that, feel free to send a note to Megan Taylor, the director of the Institute, or reach out to any of us at School of Public Health, and we're happy to help you navigate that. So thanks again, Jenny, and thanks to all who joined us to listen into our PHI preview webinar. I hope that you learned something new today and that you figured out if this is the right class for you. So I hope everybody has a great day. Thanks so much for participating.
Yeah, thank you, everyone.
Thanks, Jenny. Bye-bye.
Bye-bye.